think about all the systems that are shut down because you can't breathe right. The oral appliance isn't going to fix it. The CPAP is definitely not going to fix it, because what's going to happen is the body's going to acclimatize or get used to that level of band-aiding. And then it's like, okay, you know what it is? The little Dutch boy with his finger came to mind with a dam. So you put one finger here, and then you put one finger here, and then you put one finger here, and you put one finger, and then you're not going to have enough fingers or toes, and then the dam's going to break. And it's exactly the same concept.
Okay, my friends. One of the reasons I went into the work that I do is it was an effort to heal my own trauma. And as a result of that, from having TMJ my whole life, from having jaw surgery when I was a teenager and not knowing really how to heal and not getting the right kind of support after that surgery, I wanted to know what I could do to heal later in life, because we really never stop healing, right? You hear me talk about that all the time. And it's really how havening came into my life. It was the first time I was ever haven was on the trauma from my surgery years later. But what we're learning is that it's all connected. Everything from head to toe, it's all connected. So when I was introduced to Dr. Claire Stagg, a holistic dentist who believes in the whole body approach, thank you so much, I knew that her story and her method would resonate with so many others, because I've had these conversations with so many, Dr. Stagg, about TMJ, jaw issues, clenching, grinding, stress, and the problems that happen after, the breathing, the sleep apnea. And it's such a common problem. So when you came into my space, when I was introduced to you by a client who you introduced me to, I knew that you were the right person to talk about this, to share the journey, to share possibilities. And I am so grateful that you are here.
Well, thank you. Thank you. And I think it would be good to, if it's okay with you, to answer your questions and your journey, because I think you went through the whole gamut of from the start out the gate to the journey itself. So
Yeah.
the first thing I'd like to add is that surgery is a massive undertaking. And unfortunately, one of the things, because you and I have talked before this, is that without stepping on too many toes and being politically correct, it would be wise to figure out why orthodontic surgery is being done. A lot of times people are having their jaws move forward without understanding how the whole concepts work. And a lot of times some things can be done, so a lot and some can be done non-surgically. You just don't know what you don't know until you know it. So surgery is a end all be all concept, and if you have a broken bone, it's a good time to put things together. But the head, the cranium, all these things keep moving all the time. I have a skull here with sutures. I mean, this is just the top part, if you will. This is the front, the head. You can tell Fred moves a lot too with me. Then this is the part that I work with, and this is what I tell everybody. This is what I do, right? This part, and then this part, right? But not as crooked. But what happened is you had your surgery to go ahead and to fix something that might have been fixable without it actually having to have the surgery. So here we go. I'm trying to put it all together for you.
And showing us on YouTube. We are on YouTube in case anybody wants to watch the video rather than just listen. It is on YouTube.
Right. So what I'm trying to say basically is that if you approach and saying that you need jaw surgery, please educate yourself more before you go down that rabbit hole, because it makes us a lot harder for us who are coming in behind to work on to have arch expansion or arch development or airway issues to resolve them if we're trying to move bone when you have screws tying them in. That's all I'm trying to say. So I interjected very early on. I'm sorry, but that's where I think if you start off the gate that way, and I think unfortunately your issues, if I may say so, continued and stemmed from the actual surgery. They were trying to do one thing, but you ended up with a lot of other things. So that's where we have to weigh the pros and the cons, right? It's
Absolutely.
very delicately put.
Yeah, and it's something that, back in the 80s when this surgery was done, I was 15 years old. What
Mm,
was known about it? It was pretty much a younger surgery. The surgery itself was hours. The healing process was 8 to 10 weeks with a jaw wired shut. And just, if this is triggering to anyone, I just want to preface that we're going to go there, that this surgery was not a minor surgery that you're doing in a dental office. I had a doctor that dealt with the face. I had an orthodontist. I had a dentist. It was like this team. And
mm.
even after the surgery, a year later, I had follow-up surgery. And I told myself, I said, this has got to be it. Like this, there can't be more than this, because it was very traumatic. And the years following, because I was still growing, there was movement still happening, obviously.
Right.
So,
And at 15, you're not finished growing. And that's the other
right.
thing too. Girls and boys grow differently. Girls can grow, still continue growing sometimes up to 18, sometimes maybe even 21. Boys start later, but they can continue growing. I have a friend of my former husband who was continuing to grow tall at 29 plus. So it's everybody's different, but 15 is very young to do that.
It was young. It was a decision I had to make.
We could start a column of pros and cons there, Hilary, of things that could go really, really well and things that we might want to wait because they might cause problems later on, right?
But this is also something that you have a lot of younger patients. And I
Mm-hmm.
know that there are moms and dads out there that listen, that this might not be for them specifically, someone who's in my age range, but perhaps their child has breathing issues, or they
Right.
are dealing with, I had the malocclusion. I had a protruded lower jaw, and it was causing a lot of lockjaw and pain and discomfort. And to go to that extreme after braces, I imagine that's not the approach this day and age, because there's more science, there's been more development. So it's also to give parents an understanding of information that they're getting about holistic dentistry and other possibilities before taking that approach with their children, even.
All right. So let's go ahead about and interject also because you had four premolars extracted, correct?
Yes, I think you're talking about the wisdom teeth.
No, no, no.
Oh,
Wisdom
no.
teeth are the 18-year-old molars,
Yeah,
right? So we in
right.
theory have 32 teeth. All right.
Mm-hmm.
Unfortunately, and I'm just so we're gonna talk about all the not to do things. All
Mm-hmm.
right, to put it in quotes for air quotes for those who are listening. There are a lot of things that and I'm not bashing orthodontists. Please don't get me wrong. I'm not. I do orthodontics too, so that's not the issue. There's different ways of doing things, all right? Um, one of them, and if you read or you know of Weston Price talked about nutrition, about airway, of growing arches, all right, your head, your neck. So basically, we're back to this again, all right. And unfortunately, what happens is that when you have the jaw joint like this, all right, this is think of it this way, like this, and then like that. When you translate, okay, what happens? A lot of times you end up with a jaw disorder or a joint disorder if this whole part, this maxilla, this part is not developed enough. And it sounds to me like what you had was an underdeveloped upper arch,
Mm.
right? So unfortunately, a lot of times people say, "Oh, this one," they think that this is the normal one, and then this is too far forward. The lower jaw is too far forward, and that's why you end up having all these issues. Let's go ahead and let's take teeth out and bring the jaw back. Well, you've just created a joint problem, a TM joint,
Mm-hmm.
temporomandibular joint problem, because now you shove the joint back, the jaw back. So now you see the cascade of events, and this
Absolutely.
is what I was trying to say: the cascade of events of all the not to do's. So first of all, figure out why you need surgery, what has happened, and then all the not to do's. So you can't compound a problem with another causing causative problem that will create another set of problems. So the first thing that you want to do is you want to be able to develop the arches and figure out which one truly is underdeveloped. Because 9 times out of 10, it's not necessary that the lower jaw is too far forward. Most of the time, it's because the upper arch is not developed enough. And so, in order to balance them, conventional orthodontics go ahead and say, let's take teeth out to make more room. Well, there's just so much. Think of a garage. This is my favorite analogy that I use. All right. Think of a garage. And let's say you have a 20 by 20 by 20, four walls that are 20 feet long, right? So
Mm-hmm.
it's a square. Okay. And you say, you're going to make more room, and you decide to take 4 feet off in the length of each side of the garage. Will you have a
Yeah.
bigger or a smaller garage?
But you're not going to have a lot of space for those cars, that's for sure.
Correct, but you have a smaller
Right.
garage, right? And
Right.
it's
Right.
exactly the same thing with the mouth.
Mm.
All right. So think too now that you have on top of that garage, you have another room, all right, which is the nose. The nose, if you will, is a hollow space, all right? But the floor of the nose is the roof of the mouth, which you've just made smaller. What are you doing to the nasal passages? It's the same exact thing. Now you've brought the jaws up and back. You've made the garage or the box smaller. You've made the nasal passages smaller. Now, you've brought everything back. What's back here? It's the tube that the airway is. So you start breathing through the nose, and the tube continues from the nose down to the throat.
And again, I just want to mention to folks, if folks are actually listening and they want to see what Dr. Staggs is talking about, you can go ahead and find this podcast episode on youtube.com/Hilary Russo. You'll see all the podcast episodes there to watch as well if you want to do that.
So if you go ahead and you think about it, this is a person laying down, but this is the best picture that I can have right now to where we need to breathe through our nose. A lot of people breathe through their mouths, but no matter what, if you lay back and everything closes up, then you have OSA or obstructive sleep apnea. So basically what I'm trying to say is the rabbit hole started by probably the diagnosis of lack of airway or lack of space. And so that's where it would be important to go ahead and to determine what type of space do you want? Which space are you trying to open up? The nasal passage or the oropharyngeal passageway? And oral for mouth, pharynx is the back where the throat is. So in your case, it sounds to me like they wanted to go ahead and to move your jaw so that you can have straight teeth, right?
That was part of it. And also, I was getting a lot of pain and jaw aches. So they
Okay.
broke it, set it back. And I don't know if I truly remember everything because I was a kid. You know, you think you're getting braces, retainers, it's all to straighten your teeth. That's it. Day is done. Perfect teeth, and you're happy. But there were more issues I was dealing with. And that is where I am now, 35 years later, where the problems have become the obstructive sleep apnea, movement, and wondering where does one go next when you have years in between and other issues are now coming up.
Right. So the rabbit hole. You're down at the bottom of the rabbit hole, right?
Mm-hmm.
Okay, so we're not going to cry over spilt milk because it is what it is. It's done.
Mm-hmm.
But now you're aware that there are issues that you have to deal with. Okay, so then the goal is to figure out how we can get you out of the rabbit hole by reverse engineering what has occurred. So basically, now you're going to address your airway, you're going to address your jaw joints, you're going to address your bite, and you're going to address your nasal passages, both upper and lower. That's the airway. All right. So this is where you mentioned that you were talking with sleep doctors. Okay, that's one part of the orchestra, if you will. All right. Then you're going to talk with dentists. That's the other part of the team, if you will, the orchestra. I like to say that patients are the music. You either have harmony or cacophonie. It's a French term. You either have chaos or you have health, right? So the whole idea now is to figure out who's going to be in charge of trying to figure out what's wrong, what happened, where you are now, because we can't reverse engineer everything to if you have screws in there per se. All right. But the whole idea is to figure out what can we do to either see what we can ameliorate or make better and or stop from getting worse. So that's the interesting part, is that's where you really need to figure out where you are now. If you do have an airway issue, to what intensity is the airway issue an issue? Um, those of you who do not know anything about sleep apnea, we have either a sleep test, a home sleep test, to where you can take a little apparatus home. Dentists, we're not allowed to diagnose sleep apnea, but we can treat it with oral appliances. So mild to moderate sleep apnea, we can treat with an oral appliance. Severe sleep apnea is supposed to be treated the gold standard of care is with a CPAP machine,
Mm-hmm.
which stands for continuous positive air pressure. It's like a reverse blow dryer mower back up your nose or your mouth, right? So if you consider that you have an issue, then we need to figure out what your index or your indices are. So again, a lot of this is on my website,
Mm-hmm.
healthconnectionsdentistry.com, where you can read up on the sleep screenings. Again, we cannot diagnose sleep apnea, but we can treat it with an oral appliance, mild to moderate sleep apnea. Usually at normal 0 to 5, your indices are normal. 5 to 15, it's mild sleep apnea. 15 to 30, it's moderate. And over 30 is severe. Now, those
Mm-hmm.
are just the standard of care, the norms and the indices, and who cares, right? All you really need as a patient to know is whether I can breathe or not. Please let me breathe or not. Or help me breathe. So, if you go ahead and you consider, then that's why you can have a home sleep test. And we do home sleep tests because it helps me figure out as a dentist, because I can treat a functional breathing disorder that is in my wheelhouse, but I cannot treat sleep apnea without it being diagnosed by a physician. So, if you have officially been diagnosed, as you have, Hilary, with by a physician for sleep apnea, then that's where too you need to find yourself a doctor, dentist who is versed in this type of care. So then you need to figure out where you're going to go from there.
And I think that's the thing. And I've talked to other people, and I know folks are tuning into this episode of Holistically Speaking with Dr. Claire Stagg. Just to remind you, we will put that information on the website. We will put everything about the healthconnections.com dentistry, also her book that we're going to talk about that just came out that's doing very well. And the questions I've been hearing from some who have been in these forums are, if you've been diagnosed with moderate sleep apnea like myself, I've also been through this traumatic TMJ surgery. I'm 35 years in. I know there are little plates in my mouth from the initial surgery. And I've been given a referral to see an ENT, a referral to see a pulmonologist, a referral to see a speech pathologist. But then there's the airway side, and then there's go find a dentist. And it can be very overwhelming, like where to go first,
Right.
right? And I
Right.
think that's the similar question I hear from folks. Where do I
Right.
go first?
Right. And that's where I said the orchestra. All right. So
Mm-hmm.
I like to think that a doctor like myself, a dentist who sees the medical side as well as the oral dental side, I liken it to the conductor of the orchestra. The
Mm-hmm.
orchestra, the parts, the wind, the pipes, the drums, the bass, the whatever, the strings, whatever, all the different parts, if you will, are all the different doctors, if you will, who are going to partake in making music. The patient is the one who is the music. And you either are going to have that harmony where everything just falls into place and that everything works well and you're healthy, all right, or you have everybody throws something at the wall and expecting something to stick, right? And it's putting it politely. So the goal is to get the bullseye the first time.
If you fail to plan, to plan to fail, right?
Right. And so the goal now is someone like myself, and we talked about this, is we got
Mm-hmm.
to figure out where you are exactly in this point in time. It didn't really matter so much anymore now because you've had that surgery and that changes and has changed you forever, but where are you now? What are the building blocks that we can use now to move forward? Interject here for the parents and for those who are asking, yeah, but this doesn't pertain to me.
Mm.
Well, we can work with children. With the AF systems, Dr. Nordstrom has come up with systems to work with neonates. You can do the tie releases. You can start as from the newborns on. The whole idea is to breathe properly. Once you breathe properly, as in you have proper tongue position and then you have proper nasal breathing, then you set yourself up for success, right?
Hmm.
Unfortunately, with the modern diet and with the way that things are going nowadays, unfortunately, things retract a lot and you don't have that room and you end up with disorders. And you went through what you went through. Okay, so if we go ahead and we have that conductor, I circled back now to the music. All right. If you go ahead and you have a team, somebody's got to know what the right hand's doing, somebody has to know what the left hand's doing. But together, we make sure that we're all on board with the same ultimate goal, which would be to get you to breathe again properly. What I heard you say is that you went to see an ENT and they have their own wheelhouse, they have their own tools, they have their own tests, they have their own, we got to do this, this is it, this is my way or the highway, right?
I haven't actually gone to the ENT yet. I have a referral
Right,
because I'm like, I want to go the right route before somebody starts telling me, oh, you need this, this, and this. Like, I
right.
did consult with one dentist who said, you need a CPAP. And I'm like, you don't even know what you're talking about.
That's the weekend course.
Right. That's the, oh, I heard sleep apnea. I'm not a sleep dentist. I don't even deal with this stuff, but I've heard this is the best route to go. I don't want to hear I've heard. I want to know what
Right,
is good for me because it's bioindividuality. This is
right,
what I've been through. So I'm in this place where do I go to the ENT first? Do I go to the pulmonologist first? Do I go to a dentist who deals with, who is specializes in airway and TMJ? You know, that's and
right.
sleep apnea, which obviously falls under that.
So one of the things you need to be aware of is the American Dental Association does not recognize these as specialties.
Mm,
Unfortunately, I think that will change. My practice, I have an emphasis in treating sleep apnea, TMJ
hmm.
disorders, head, neck, facial pain. So that is one thing that you can be aware of. The second thing is a lot of us who do this have had many hours of extra training. It's just not a weekend course. I mean, I've been doing this for nearly 20 plus years to this intensity, and it's a process. I keep learning. I mean, I'm still going through a residency for pediatrics right now, and it's a lot that I know, but now I'm learning to fine tune and I can deep dive a little bit more for certain things that I haven't been able to do because it's same old, same old. Plus ça change, plus c'est la même chose, as we say in French. The more it changes, the more it's the same. So there's a lot of different things, but like you said, I like that bio-individuality. So everybody's different, but everybody's the same. It's just you can't use one cookie cutter technique, but we're all humans, and that's
That's
where it's all
right.
connected. So we're circling back to how it's all connected. And if you have somebody who understands how it's all connected, that's when they could guide the ENT to say, hey, you know what? This is what I suspect. I use the word very underlined, bold caps. Suspect. I suspect, for example, she has a nasal valve collapse. I suspect, for example, she has a deviated septum. I suspect she has, sinus issues. I suspect that she has pharyngeal obstruction. Could you please verify for me? Could there be upper airway resistance syndrome? I suspect that she may be having obstructive events. You might even have central apneic events. We don't know. So that's where you get somebody who understands as a dentist. All right, because we're the best ones. And this is what floors me. And I'm just going to put something for hoorah, hoorah for
Yeah.
my team. My team.
Hmm.
All right. This is what we do all day long. We're in the mouth. We see this stuff day in, day out. What bothers me is that they don't train dentists nowadays to read the signs of obstructive sleep apnea and or airway disorders, that's going to change. That's all in the book, by the way. Every single sign you could think of is in the book. But I think that's what needs to be changed. It should be common sense that it's not drill, fill, and bill. It's actually determine what you see that it's not normal. So I would hear patients tell me entire lives they've had these tori. They look like little mushrooms at the bottom of their jaws or one on the roof of their mouth, on their palate. Oh, my dentist told me that was normal. No. Normal for whom? All right, I digress. So anyhow, what happens is if you have a team conductor, then that dentist who understands this, who is more versed in this knowledge, can go ahead and say, okay, then this ENT, could you please help me accomplish XYZ? If you have a sleep doctor, all right, you don't want to get lost in the rabbit hole of medicine.
Right.
Because that's the other thing too. You could very easily get lost in that rabbit hole. All right. So
Absolutely.
you want to stay with those of us, because your mouth, your head, your neck this is our wheelhouse. The ENT is ear, nose, and throat. All right. Sleep, they're the physicians. They're the ones that are gonna, yes, they prescribe the CPAP. Yes, they're the ones that are gonna diagnose it. But at the end of the day, it's still the dentist that's gonna do the appliance for you, one way or the other. It's gonna be something in your mouth,
Right.
right?
Right. And I prefer to go that route.
It bugs me that now you have physicians who are doing oral appliances is like, okay, you won't let us diagnose something that we deal with. Okay, yes, there's the medical, the physical aspect, the insurance part, blah, 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 of sleep apnea. Yes, there's a lot of pathophysiology that needs to be dealt with by a physician. Get that, get that. But don't go make an oral appliance for my patient. You don't know what you're dealing with. You don't know how to make it. You don't know what position to do it. And you certainly don't know how to put it into the way they breathe better, and you don't know how to check it, and you don't know where you're putting that jaw joint. So yeah, that kind of bugs me a lot. Sorry.
I think that's part of the reason why. No, share. This is an open space. I mean,
Yeah.
if you want to drop an F bomb, you can. I don't mind.
I won't do that. I'll keep
but
it polite.
I can say it in French.
Yes, yeah, I can French it a lot.
Right, you can French your way out of this. So my thing is, and I've thought this, but from talking to you, from talking to others in the field, that even though I've been given referrals, I've been holding off on filling those referrals because I'm like, I think that's just a doctor telling me this is what's normal and this is how we normally protocol this. My gut tells me that it's somebody who deals with this face all the time. And that moves into the next things, like how do you find that sleep dentist? How do you find a dentist who is experienced or emphasizes work in that area and know that you're getting someone who's good and isn't just going to say, hey, we'll get you fixed up with an orthodontist and now you're going to get a palate expander, or now we're going to do the surgery over. Because that's a fear that I've run into, as well as one that I have on my own. Like,
right, I wouldn't go there yet if I were you. Okay, just stop. Whenever you hear surgery again, just let's think this over. All right, so let me give you some of my feedback too. Right, there was a sleep course. All right, and I thought, okay, cool. I'll go ahead and I'll support the doctor. And then I go find out that all they talked about was appliances. And I'm thinking, okay, but you're doing an appliance, but you're treating the symptom. Nobody's talking about causes. And that bugs me to high end. And there was a children's neurologist in a very, very prestigious hospital, Boston, I think it is, who said, yes, I mean, it's all fine and good, because they said, oh, don't worry about it, blah, blah, blah. And then she said, no, 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 I think she has a point. And I said, yes. So the thing then is that, all right, if you go ahead and you think about all the systems that are shut down because you can't breathe right, the oral appliance isn't going to fix it. The CPAP is definitely not going to fix it, because what's going to happen is the body's going to acclimatize or get used to that level of band-aiding. And then it's like, okay, you know what it is? The little Dutch boy with his finger came to mind with a dam. So you put one finger here, and then you put one finger here, and then you put one finger here, and you put one finger, and then you're not going to have enough fingers or toes, and then the dam's going to break. And it's exactly the same concept, because if you go ahead and the concept of an oral appliance Okay, to come back again, and I'm showing the picture to mild to moderate sleep apnea. It's called a mandibular
Mm-hmm.
advancement device, or MAD for short, right? Okay, well, what does that do? It brings the lower jaw forward. Why? Because the tongue is attached to the front of the lower jaw, so you bring the lower jaw forward. All right, so that's the mandibular advancement device. Well, how far are you going to be able to bring the jaw out of socket eventually? No,
Right.
because if you don't address the root cause, you're going to have inflammation. So that airway that's already restricted, be it because of diet, because of environment, because of whatever, you have large tonsils, which are supposed to be there as buckets to hold whatever pathogens or whatever bugs that are in the air or that you're eating or whatever. They're the engines that are holding the fort down, if you will, or the soldiers, whichever. They're the ones to protect you so that things don't go to your lungs. But eventually they get overwhelmed, and that's when your airway is so closed up by these massive tonsils. And then again, let's take them out. Surgery to remove tonsils. All right.
Did that
Okay.
too.
Right. So I know I'm jumping everywhere right now, but I'm trying to go by the anatomy.
Mm-hmm.
If you'll follow, there's a process to my reasoning here. So the dentist will say, okay, let's do a mandible advancement device for mild to moderate sleep apnea, but that's not treating the root cause. All right. The sleep doctor will say you need a CPAP because it's severe sleep apnea, but that's not also treating the root cause, because somewhere along the line, if you don't have a nasal up, what we could call a patent nasal passage or passageway to get air through your nose, all right, then or if you're doing a CPAP to push air down your mouth, which you should be breathing in your mouth anyhow, then you're still not getting the air, the quality of air you need. As a sidekick, just so you know, when you breathe through your nose, you actually develop nitric oxide.
Mm-hmm.
It's a gas, all right, that you develop it, you create it. As a human, we create nitric oxide in our sinuses. When you don't nose breathe, you're not getting your nitric oxide, which means that your vessels are getting harder faster. You age faster. All right.
Mm.
None of that's going to happen with a CPAP, and none of that's going to happen with the appliance, because 3 months down the road, there's just so much that you could advancement that you can do. There's just so much titration with a level of pressurization with a CPAP that you can do, and eventually you're back to square one. Okay, well then now let's do orthognathic surgery to bring your jaws forward, and then that's when you have another issue because now you're locked in. So let's tie back that in with the anatomy. Remember, I showed you, and those of you who can't see, the skull is not fixed. There's lots and lots and lots of little sutures. That's why I was saying there's dozens and dozens and dozens of bones, but they're all connected. And the cranium, the housing of the cranium, but there's lots of them underneath, all right, under the skull, all right. So what happens is all these bones actually pulse. That's called the cranial sacral rhythm. All right, that's where cranial sacral therapy would be really good. That's where you unfortunately have issues because you have screws holding your face, your facial plates are held together, right? So we're trying to go through all the systems and the scenarios here. An ideal person who hasn't had surgery can have all these little bones changed because they're not fused together. They are not fused together. They are not fused together. What did you hear me say?
They're not fused together.
They are not fused together. So if anybody says that you cannot expand your palate because you're over 9, run. It's not true. I expanded. I've done an arch expansion on an 83-year-old.
Mm-hmm.
All
I
right.
actually had a conversation with a dentist who told me that women, they're finding, and tell me if what your thought is on this, the palate of a woman actually is able to expand for much longer than we originally thought, years wise. Like and maybe I'm saying this wrong, but she even had a palate expander in the top, and she's in her 50s. So I'm
Mhm.
curious. I mean, is that an approach to try?
So can a guy, it's a human, period.
Anyone can, anyone. Okay.
A human can have. Mhm. Now, I
Okay.
don't know if there's going to be a sex differentiation For the progression of the
Mm-hmm.
treatment, I don't know. But any human can have their arches expanded, and short of having a disorder of one sort or the other. But in general, you can have the arches expanded because the bones are not fused.
Right. It's not here, it's here.
Let's talk about why you can develop a palatal expansion and growth. All right. This is a totally misunderstood concept. All right. Remember, we talked about the roof of the mouth
Mm-hmm.
is the floor of the nose, and this is magnetic. So bear with me. That's why it was all catawonka earlier on. So in here, you have what we call the nasal passages, and you have a thing called turbinates, right? So if you look at it, there's little windmills in here. So you have anterior, middle, and posterior nasal passages too. And here you have what we call the sinus, the maxillary sinuses. Here you have the frontal sinuses. All right. Okay. So how arch expansion works, and this is why you do slow. Slow is good. What you do, remember, this is magnetic, so it might be a little hard for me to do. You go ahead, you do a little bit. All right, you do a little bit, and then you wait. Then that goes ahead and creates bone. Then you do a little bit, then it creates bone. You do a little bit, and it creates bone. And so slowly but surely, you've created the arch that is wider because it happens in the middle. All
Mm-hmm.
right. If you go too fast, what happens is you end up having extrusion of the teeth or the flaring of the teeth and or what we call the buccal plate perforations, which is what the orthodontists freak out about. You're going to flare out the teeth because you're going too fast.
Well, how long does something like that take normally? What is that process?
They do what the orthodontists usually do, what they call rapid palatal expansion. Slow is the best thing. Do a little bit, grow bone. 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 Guess what happens? Unless you have a septal spur, which acts like a handcuff to hold that nasal passage, that septum tied up to the another bone on the side. If you don't have a septal spur, that deviated septum just lines right down. That's what happened with me, and I was in my 50s. I was over 55 when I did mine.
Mm.
If you go ahead and you do slowly, you can expand an arch. Now, there's a school out there that says, let's do it in a month, and then we wait 6 months. It's like, okay, that to me sounds so wrong. And then this is my humble opinion for each time I'm giving you anything. These are my humble opinions and what I've learned and what
Sure.
I've read
Sure.
and my interpretation of everything. Okay.
Of
But
course.
if you're going to go ahead and you're going to go like zip and then wait, all right. The big fallacy with that is you zipped and you waited 6 months, and that space in theory is supposed to grow bone. It fills up with collagen. That is why
Mm.
when you go too fast in kids or no matter what age, if you go too fast, you end up with a ton of relapse.
Mm.
So
Don't.
slow, a little bit, grow bone, a little bit, grow bone, a little bit, grow bone, a little bit, grow bone. Now you have success.
Now, this is just one approach, right? The palate expansion is just one approach.
Okay, that's the transverse approach. So if you're doing this in 3D, you have to think your garage, right?
Mm-hmm.
Because you have width, you have depth, and then you have length.
Mm-hmm.
Well, it's the same thing. This is the width. The transverse effect is the width. All right. Then we have the sagittal aspect, which is from the side. So that's where, too, for example, if I'm not mistaken, that your issues came from is that if you look at my profile and they said that this part of you was there, but this part of you was too far forward. So I'm going to exaggerate
Correct.
now, like that, right?
That's
Right?
exactly what it was like.
Right. So
Yes.
it wasn't that this was too far forward. It can be, but in reality, it's that this was underdeveloped.
Mm. Mm.
So that's the side view or the sagittal view. 9 times out of 10, if you have an airway issue, it's because you're overclosed. And then you need height. And that's when we can go ahead and do height. Interestingly enough, oral appliances, the same one that they advocate to go ahead and do the mandible advancement devices, the same thing. There's two things that they do when they're doing a sleep appliance. What are they? protraction and vertical. But they're doing the protraction with the lower jaw only, and vertical, they're putting the special amount of vertical or the height into the appliance's acrylic.
Now, there's a lot of information that we're sharing with folks. I'm taking in a lot of information. I do want to mention real quick that Dr. Stagg has a new book that just came out called
Yes.
Smile. It's all connected, whole health through balance. I'm going to put a link on there in the podcast notes rather to grab that book, because this is really something that was written for the everyday person to understand. It's not like reading a medical guide or anything like that. You will be able to go to an upset or an issue that you might be confronted with, learn more about it, because as we were saying before, what gets measured gets managed, but also we have to be our own healthcare advocates, and
Yes.
then find the right kind of people to support you, because obviously you can't fix the problem yourself, but
Right.
you can support yourself in that. And also I know you have a children's book, and that's Captain
Yay.
IFBI. I love
Yes. Yes.
that.
Captain IFBI.
Right, encouraging good oral hygiene habits, which, by the way, that ties in with the download that you are offering as well, which is the dental protocol checklist. And I love that. We're going to put all that in the podcast notes so that folks that are tuning in, or if they're watching on YouTube, because you're showing us some fun stuff on visual, they'll have the option to either listen to this anywhere we have podcasts and also on YouTube. But on that note, if you feel that this podcast episode with Dr. Claire Stagg inspiring you anyway, touches you anyway, if you know anyone who might be confronted with any of these upsets, whether it's sleep apnea, whether it is TMJ, or any kind of upset that you might be dealing with the dental side of your life, or even breathing, this is something you can pass along to somebody. Share it, let them have the knowledge and make a decision where they want to go next, because we definitely are sharing some really good information here. And I really appreciate it, Dr. Stagg. I know we're talking a lot about my upset, but I know there are other people out there that are dealing with the sleep issues, the sleep apnea, the breathing, the grinding, the bruxing, and wanting to change the holistic approach to dentistry.
You're just a normal person, sweetie.
I'm just like everybody else.
Yeah.
I know I am. And it's one of the reasons why I do this show, because many of the things that I'm facing or have seen with clients is something I want to talk about, so that I can make this a vessel for others to get answers, or at least find something that they could take away from this and hopefully make a choice that helps them become a happy and healthy grown up.
So let's talk about the book. This book was written, it's taken me 10 years to get it out here. All right. This book was written for the average layperson. It's a conversation from one mom to all the other moms who have asked me questions all these years. I've been practicing. I graduated in 1982. So I've been at this for a long time. I came to this country in 87. So I was not of American training per se. So I have had different training. I'm also a very outside the box thinker, and I like to ask why. So why do you want me to do it this way? Give me a reason why I should do it that way. So the whole idea was to understand that, yes, why aren't these patients getting better? Why is there cacophony? Why is there not harmony? Why do they have all these issues all the time that they haven't had resolution for, and that I have not been able to finger point? So that's when I went down my training. What's going on? What's going on? What's going on? So the book's goal is to go ahead and to change the demand, because to educate the demand, if you will, because the more people are educated in this, is the more they'll understand what's actually going on. It's for you to be your own advocate in your own choices, just like Hilary at 15 did not know any better or any know what to do or not to do. Her mom or parents didn't know, because they followed the advice of their physicians, which is okay. Don't get me wrong, but why don't you find out, if you go ahead and you're playing a game of poker, wouldn't it be nice to know your hand? instead of playing
Yeah.
blind. You know what I
Yeah.
mean? So this
Absolutely.
book has the entire deck in it. This is what I'm trying to say. It's written with you for everything that Hilary and I have talked about. And I think one, if you have the book, you will see anything about airway, you'll see about joints, you'll see about teeth, you'll see about muscles, you'll see about nerves, how it used to be, how it is, and what the connections are: structural, chemical, mechanical, functional, emotional, spiritual, because we're all one. And then in the future, where I think dentistry should and could be. But I think, and I know that if we change the demand, the supply will have to change, because the more the moms and the dads and all of us understand how this is connected, they're going to have to teach doctors how to connect the dots too. So that was the goal of this book, is to change the way dentistry is perceived and experienced in the world, and then change the world for a healthier, better place, people to be healthy so they don't have to suffer like a Hilary.
Yeah, I so needed. I wish my parents had this back in the 80s when I had this surgery. Even though it was different back then, we've progressed, we've gotten better, we're more knowledgeable, we have more tools available to us and science and approaches. But it's here now, and if my
Right.
what is the saying? Someday your story could be somebody else's survival guide. I use that one a lot. I know that's Brene
That's a good
Brown.
one. Yeah.
Yeah, I'm hoping that this next stage of my own journey is much less invasive and more productive. You know, it's
Right.
just it's finding ways. So having conversations with doctors like yourself, people who practice more of a holistic and whole body approach and aren't really running right to surgeries and appliances and everything that might not be the best plan. You know,
Right.
it's constructing the plan, building the house and realizing what size garage is really going to fit and what kind of cars do you have for that
Right.
garage,
Right.
right?
Because there's
So,
different appliances too. So there's different arrows in your quiver, because you
yeah.
want to shoot for the bullseye every time, right? And
Yeah.
that
Yeah.
that's where I did all that additional training. It's like, okay, so we have a joint issue. Well, let's deal with a joint, but then you can't disconnect the tongue and the space that the tongue holds. And then, okay, so now I do tie releases. So, and not everybody's going to practice the way that I practice. This is my passion, though. And you talked about your survival journey. My daughter fell and hit her
Yeah.
chin when she was 3.5. And that's where she hit her chin, which automatically put her jaw joints up and back, got her disc displaced. So here I am searching for answers back in 2003, 2004. And that's where I ended up. So yes, I was doing the chemical aspect where we were mercury free, we were doing all the nutrition, everything. But then I was like, how do I fix my child? How do I get her to not be in pain too? And so that's where it's like, okay, let's do this. Let's figure out how we can make this happen. And so that was my journey to go ahead and to put that together for all the other
Mhm.
parents who would have these questions.
Yeah. And interestingly enough, here you are, a dentist, being confronted with something that you think, oh, I have the answers because I'm a dentist. At least it happened to a dentist's daughter. And you're
Right.
looking for the approaches that are going to help her heal and live her best life the best way possible. So,
You know what makes me laugh too? No, I guess I'm getting very spicy today.
I like
Very,
spicy Dr. Staggs.
very spicy. So I remember I had this 83. Well, he's 90 something now, but he was clearly apneic. Clear. I mean, his lips were blue. All right. He had no airway, really, really bad. And so I told him, why don't you do a sleep screening? No, 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 my doctor, blah, 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 blah. So I went ahead and I said, okay, ask your doctor to go ahead and send you to a lab and have a sleep test. So he goes ahead and he tells his physician that, and his physician says, what does she know? She's just a dentist. Yeah,
Ay, 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 ay. I
yeah.
wish we could all just get along and work together.
So
I
anyhow,
don't
that's my
understand
two
it.
cents again. So don't read a book by its cover. and look for somebody who understands how it's all connected. And there's going to
Yeah.
be more of us. There are more
Yeah.
of us. It's just you don't know where to find them.
So, what I want to do real quick in closing, I usually do a game with all of my guests.
Love games.
And what I've been doing is I pull, hey, you're going to have a little fun. This is what we do here. Not everything's so serious. I'm going to throw out a word, something you said today, and I want
Yes.
you to come back with the first word that comes to mind. Just a quick word association game.
I already want to say happy.
Say happy as much
All
as you
right.
want. But if I say the word holistic, what's the first word that comes to mind?
Body.
Jaw.
Oh God, pain.
Palate.
Growth.
Airway.
Life.
Dentist.
Happy.
Smile.
Beautiful. Happy.
Yeah.
Beautiful.
Love that. I love that you focus on the word happy. Just be your own healthcare advocate. You know, we don't have to throw out a name. There are a number of things out there that are good, and there are a number of things out there that are not so good. And you have to be your own healthcare advocate to make that choice.
And things could work different strokes for different folks. I mean, it could be the best thing. Anything could be the best thing for anybody. It's just that sometimes when you don't know any different, you wish that had I known, I
Oh,
wouldn't have
yeah.
done it this way.
That's kind of where I am. I
Right.
wish I knew at 15. So I'm hoping that what you shared, I know we'll have more conversations because I'm on a route where I'm going to be looking for approaches.
Oh
Because
God, my eyes.
unfortunately, we're not in the same area, but that doesn't mean I wouldn't hop a flight to come down to Florida, by the way.
No, you still can.
I can. But I know you have a tight schedule, a lot of people to talk to. You're in high demand, Dr. Stagg, and for good reason. And I'm just so grateful to have you here.
I am eternally grateful to you interviewers because you have platforms that you can spread the word to the world because you're the ones basically that are going to change. I'm just flotsam on the ripple of the thing, you know. I'm just like, hey, go this way, go this way, go this way.
We're all in it together. As you
Yeah.
said, it's all connected. We're all connected. So if we can do anything to help others, that's what we're here for. And I'm just so grateful for you. Thank you so much.
Thank you too. And thank you for having me. And so on a one little note, I was like, this is my last little saying in the book, which has lots of little life lessons. My one is that you're not a drop in the ocean. You're the entire ocean in a drop. So blessings, Hilary. I love you. Thank you so much.
I love you too. Thank you for being part of the Ripple.
Thank you.
I know we unpacked a lot. I know there's a lot going on here with Dr. Stagg, but for good reason, and we are not done. Next, I want you to grab a copy of Dr. Stagg's book, Smile, It's All Connected, Whole Health Through Balance, plus her children's book that she has, Captain IFBI, as well as her checklist to download for daily dental protocol. All of this is in the podcast notes. And if anything resonated with you that we shared here on the show, if you were touched, moved, and inspired by our conversation, if you have more questions, Dr. Stagg is actually holding a Q&A online on Wednesday, July 17th at 7 p.m. Eastern Time. It's a really great chance to connect with her again, maybe follow up on some of the things we talked about, or if you have your own questions, and get to the root of your dental journey. No pun intended with that one. And you can get some more knowledge because knowledge is power, right? What gets measured gets managed. So be your own healthcare advocate first. And you know, I share a lot about my havening journey, how it has been a big part of my chronic pain, my TMJ, and I want to offer you the opportunity to try havening and see if it works for you. This is a really wonderful way to overcome fears. If you have a fear of going to the dentist or the doctor, or even managing chronic pain, or maybe you just wanted to self-soothe, to self-regulate for daily self-care. It's a wonderful tool to put in your toolbox, and I'd be happy to have a conversation with you and see if it's right for you. A link to connect with me is also in the podcast notes. Holistically Speaking is edited by Two Market Media with music by Lipbone Redding. And I know you tune in week after week because you want answers, you want to find ways to be a happy and healthy grown-up, and I'm here for you. And I just want you to know that those traumas that you're turning into triumphs, they're happening. They're in motion. And I am proud of you. I believe in you. I love you. And I will see you soon. Be well.
I know